We're speaking here now with a longtime healthcare executive who's running one of the world's largest clinical laboratory networks. It is at the forefront of the testing and diagnoses for various diseases and conditions, including COVID-19. Joining us now is Labcorp CEO Adam Schechter and Yahoo Finance's David Briggs. Welcome, guys. This is going to be a fun conversation.
It's great to be here. It's nice to see you in person, finally.
I know.
Finally.
I guess the pandemic's over, right? We can just wrap this up and go home.
I wish it were over.
Well, speaking of, I think it's clear that the first thing we have to start off with you today, obviously, is just what's the market looking like right now? COVID, we know that, PCR testing, those testing sites closed down. That was a huge boon for you guys. But where do you go from here? Have you been able to return?
Well, first of all, we learned a lot from the pandemic, and we learned a lot about innovation, about science, about technology. We learned about scale. So at one point, we were able to do over 300,000 COVID tests a day. Since that time, we're doing less and less COVID tests. And as we sit here today, we're doing less COVID tests than what we did at the beginning of this year. But the real question is what's going to happen as we go into the flu season. We've seen an increase in COVID cases in Europe, and that typically is an indicator of an increase coming to the United States. So at Labcorp, we're prepared to run as many tests as we need to. We currently have more capacity than we need, but we're going to make sure we do everything to get people through the upcoming flu season.
Are you anticipating a surge over the holidays in cases and ideally in testing?
I would assume, based upon what we're seeing in Europe, that there will be an increase in cases and testing required as we go into the end of this year. We'll be prepared for it. Let's hope we don't need it, but I want to make sure that we have the capacity just in case we do need it.
So for that capacity, you're maintaining that, and you plan to maintain that, especially for COVID, for some time?
So we're maintaining about 4 times more capacity than the current number of tests that we're running, and we always want to stay at a significantly higher number that we can run versus what we are currently running. So we'll continue to watch the cases. If they go us, we're going to increase our capacity again. What we've learned is we can scale quickly now. So we'll be prepared for whatever we need to do as the United States go through the winter and flu season.
Good to be able to surge up and down. What about the at-home testing part? That's something that at the very beginning you weren't necessarily very big on. And of course, as you mentioned, innovation, that's something that now we see is a huge market, and people are maybe more willing to take tests.
Yeah, I think people, if they don't need to go to the doctor's office, they prefer to stay home. And if they don't have to be exposed to other people that are either sick or may have COVID, they'd rather stay at home. So we launched Labcorp On Demand, and you can now run over 100 different types of tests from your home. Either you go online and you can order the tests that you want, and then you can collect the samples at your house, send them to us, we'll run the test and give you the results. Or in some cases, you can actually order the test, go to one of our service centers, our phlebotomist can take the blood for you and give you results. So we are seeing people more and more apt to do at-home collections, and we want to make sure of 2 things. One, that we continue to communicate with the physicians, because we believe that the physicians are so important to the healthcare of the patient. But at the same time, if patients want to do some testing on their own, we want to make sure that we give them the results, not only in an accurate way, but in a way that they can understand the results.
It was, for many reasons, a devastating pandemic, not just for the economy, but for families around the world, and still is. How significant a silver lining were the advances, though, in diagnostic testing? And what do you think is the best application when we come officially out of this pandemic?
That's a great question. And I think the world has a better understanding and appreciation of diagnostic testing today than it did before COVID. And what we've learned is that people want to know more about their health, and not just the United States, but around the world. And we learned that the science and the innovation and technology that we've brought to the U.S. has applications around the world. So we're going to be bringing more of our innovative tests globally as we go into the future. But what we've learned from COVID is that you have to be aggressive and you have to challenge the big scientific issues. Our scientists are remarkable, and the things that they did for COVID, I don't think anybody would have dreamed they'd be able to do. They were just met with these big challenges, and they found a way to be successful. We now need to do that in cancer, in Alzheimer's disease, and in other areas. So for example, for cancer, right now, if you want to see what type of cancer people have, sometimes you have to do surgery, take a piece of the tissue of the organ to understand that. Our hope is in the future, we'll be able to do that with a blood test. And those are the types of things that we're trying to figure out.
A biopsy.
Instead of a biopsy, we're trying to find a way to do it through a blood test.
Extraordinary. How close are we to that?
We're still years away, and it's going to take a lot of science and innovation, but there are some tests today that are called liquid biopsies that are beginning to give us an understanding of how we can move forward and get better and better at doing it in the future.
I wonder, we've talked about all the positive and the growth, but obviously, number one, you had to scale up and down with staff for COVID. Yes. And secondly, Labcorp really had a really big market when it came to business and employers.
Yes.
How has that shifted with work from home, with the difference in drug testing? You know, we've seen a push for legalized marijuana as well. So how has that all come together in terms of shifting how the business functions?
Yeah, no, it's a great question. And once again, I think COVID had many unintended consequences in the world, whether it be children that had to study from home for a period of time, whether it be parents that no longer wanted to go into the office. Leaders had to change. I mean, hopefully I've become a different leader, and I hope a better leader than I was before COVID. But we've learned to have to be more empathetic and to understand that our customers are going through a hard time, that our employees are going through a hard time, that almost everybody around the world is having difficulties based upon what's happening in the world today. So I think we've learned a lot about leadership and how to lead through these difficult times. What we've also learned is that you can't be stuck in the way your business ran in the past. You've got to be open to new ideas, to new ways of doing the business. Things that if you would have asked me 4 years ago, can you actually have these jobs done at home? I would have said, no way. We've learned you can. And in certain instances, we've learned we can do things remotely that we weren't able to do before. When it comes to hiring and finding ways to get people employed quickly with our work that we do with employers, we found that a lot of employers are much more distributed now than they were before. So we have to find ways to interact with them as opposed to going on site, but do it through things like at-home testing and so forth.
Testing, when it comes to, you guys are heavily involved in drug testing. Cannabis, marijuana was mentioned there. There is a multi-trillion-dollar quest for a roadside cannabis test. Are you guys looking at that?
At this point, we've not pursued that, but we continue to look at every test where we think we can bring science, innovation, technology to make a difference. So in the future, there may be an opportunity for us, but not at this point.
So explain to me this at-home market opportunity, because it seems like on one hand, you know, there's this push for non-clinical spaces. And by that, I mean the retail pharmacies and, you know, more retail outlets for people to find your tests or the at-home option. And one of the biggest conversations throughout this pandemic has been health equity. And this plays a huge role in that. Who has access? Because I know there's a statistic about, you know, every human or every American lives within, or 90% of America lives within 5 miles of a pharmacy. Well, that's, you know, 5 miles. No one's walking 5 miles, yes. Right? Yes. So put that in context of this prospect of an $8.5 billion market by 2030. Yeah. And what stake, you've been a leader in testing so far. What stake do you think you're going to have in this market?
Yeah, so the first thing I say is health equity is important. And it's something we all have to pay attention to. And to be honest, there were things we thought we were doing great when it came to health equity, and through COVID, we learned a lot. So for example, we thought by sending kits to people's homes, if they have COVID, we can make a difference. But there's a lot of people in this country that don't have homes today. So there was no place to send the kits. So therefore, we had to find mobile ways to get kits available to people in other parts of communities. Like you said, people live within 10 miles of being able to get a sample to Labcorp, but 10 miles is a lot for a lot of people. So we continue to look for new innovative ways to ensure that we can bring our testing to everybody across the country in a fair, equitable way. There's still work to be done there. The at-home market's going to be interesting, Anjali, because I think COVID has changed things a bit. Typically, people said, I want a highly accurate test that I can get the results in a day or two, but that is fully reimbursed by my managed care plan. For COVID, they said, give me the result as fast as you can. I'll pay whatever it takes in order to get what might not be the most accurate result quickly. I don't think that's going to be the dynamics as we move into the future. So we have to be careful with some of the learnings from COVID and how it may apply to other diseases in the future. So I still think the at-home market is yet to be defined and determined, and there's still a lot more work we have to do.
Is the best practical application flu testing at home?
So we have flu testing at home. We have a combination test of flu, RSV, and COVID, all in one test for an at-home test. I think that's a great application because a doctor can ask their patient to be tested without having to come to the office. But for something like cholesterol or diabetes, the question is that a good use of at-home testing? And I'm not quite sure yet. We'll have to see that over time.
What about broader costs for this? So on one hand, you have, you know, inflation, kind of a big issue. And then on the other hand, you have a lot of focus on healthcare costs broadly. With this pivot to at home, you have, individual tests being shipped out. Is it as cost effective? Are we looking at, you're able to kind of shift things so it's not increased cost for the patient?
Yeah. So the first thing I'd say is I think healthcare costs in this country and almost every country around the world is a very significant issue that's getting worse by the day. Whether it be the United States or it be parts of Europe, we are spending more in healthcare today than we were prior to COVID, and those costs are increasing. We have to find a way that what we do in healthcare, including diagnostics, helps reduce cost. The good news is diagnostics is about 3% of healthcare spend, but over 90% of decisions are made with some type of diagnostic test. I think that we can show through prevention of disease, detection of disease earlier, things like liquid biopsies in the future for cancer, that over time we can help reduce healthcare costs. I think it's incumbent upon all of us in healthcare to find ways to help the United States and other parts of the world reduce cost.
One thing to help in that capacity would be identifying Alzheimer's earlier, and you mentioned that earlier when we talked here. Where is the science on that, finding an early biomarker? It doesn't get the attention, certainly that COVID does, and really that it should. Where is the science on that? How involved are you?
So it's still evolving, and there's no doubt that Alzheimer's disease is one of the most significant issues in the world. Every one of us knows somebody that suffers from that devastating disease, and it costs trillions of dollars in cost around the world, not just for patients that have the disease, but for caretakers and other people that are caring for people with the disease. So we are dedicated, we are spending a significant amount of energy and resources in research and development to help find better biomarkers for Alzheimer's disease. Also, some of our pharma colleagues are working on new potential drugs and treatments for Alzheimer's disease. I think you need both of those together, because it's not enough to tell somebody that they could get Alzheimer's disease. You need to tell them they could get Alzheimer's disease, and there may be a treatment or things that they can do about it in the future.
You've seen the controversy of the FDA approval process when it comes to Alzheimer's drugs. What do you make of that?
Yeah, I have a lot of faith in the FDA. I think the FDA is one of the best regulatory, if not the best in the world. And I think it's just a lot of complicated data that they work their way through. We saw some new data that looks promising, and I have no doubt the FDA will do its due diligence to decide whether or not that deserves to make it to the market in the future.
You mentioned just a moment ago the idea of costs increasing generally in healthcare. I know during the pandemic we also saw hospitals and other clinical settings where people weren't coming in to get those tests, and so it was really squeezing those healthcare settings. Do you anticipate that you're going to feel a little bit of that squeeze with the reduction in people going to get care?
Yeah, the first thing I'd say is that our frontline healthcare workers are the true heroes through the pandemic. The people in our hospitals that came in every day, they are the heroes of the entire pandemic, our frontline workers. But there's no doubt that hospitals are suffering right now, and it's very difficult. You see in their quarterly earnings how difficult the environment is for them. I think as a country, we have to do everything we can to support what I believe is one of the best healthcare systems in the world. So I do believe it's going to be hard for them. I do think that we're going to have to find ways to support them. There may be some impact on our business, but overall, our business is very broad, it's very global, and it's not just hospital-based, it's also physician and other healthcare professional-based. So I think we'll be okay. I do worry about our healthcare system in general.
Those hospitals, like just about every profession in this country, are seeing an employment shortage. Dire. Are you seeing that across your business and the 100 countries, frankly, that you're in?
Yeah, so we are seeing a shortage of workers across many aspects of our business, and I think it's across many aspects of all businesses. So we're doing everything we can to attract, retain, and develop the employees that we have. And there's no doubt that the hospitals and other parts of the health system are feeling that same pressure. You do see it in other parts of the world, frankly, and I think it's something we're going to all have to figure out how to deal with.
More acute here?
No, I would say there's other countries that it's equally acute in, but I think there's multiple reasons for it. There's some people that don't want to go into an office or into a hospital or into a service center any longer, would rather try to find ways to work from home. I think there's a whole host of issues that we're trying to solve for there, but it's something that as a healthcare system, across all of healthcare, we have to solve together.
Definitely. And when we're talking about the whole world, obviously that's something that we didn't touch on a lot right now, but talk to me about the global trends. Do they all kind of align with what you're seeing in the U.S. when it comes to this at-home testing as well? Or is it different, especially in remote areas or places that you don't necessarily get a chance to get medicines to?
I think it's a bit different, Frank. I was in Japan a couple of weeks ago, and I've gone to Japan for 25 years. They have a terrific healthcare system. They were interested to hear about at-home testing. They don't typically have that. But the first time I've been there in years where they've actually were asking questions about what did we do for COVID, what did we learn? And when I would talk about the at-home collection, there was certainly some interest there. So we'll see. I
imagine, universal healthcare systems or government-run healthcare systems would be a little bit easier to deal with when it comes to that kind of a market, maybe.
Well, I think they all have their nuances, that's for sure.
Nothing's easy, right? All right, well, Adam Schechter, CEO of Labcorp, thank you so much for joining us, including David Briggs, here today.
Good to see you.
Such a pleasure to be here. Thank you.